Hello everyone, myself Sujit Sanjay Patil, faculty Shri Jain Vidya Prasarak Mandals, Rasiklal M. Dhariwal, College of Pharmacy, Chinchwad, Pune. In this video, we are going to discuss about Mydriatic and Miotics. Contents. After watching this video, students will able to explain drugs used in eye, Mydriatics, Miotics, Horner's syndrome. Muscle of the iris, dilator pupil, dual nerve supply, sympathetic alpha 1 adrenergic are stimulatory while parasympathetic are inhibitory. Sphincter pupil, dual nerve supply, parasympathetic muscarinic are stimulatory while sympathetic are inhibitory. Miotics, parasympathomimetic drugs, cholinergic drugs. The cholinergic drugs are classified as directly acting or agonist. Example, acetylcholine, bethanechol, pilocarpine. Indirectly acting or cholinesterase inhibitor. A. Reversible. Example, phyostigmine, neostigmine, edrophonium. Irreversible. Example, ecothiopate iodide, demercarium, disoprofluorophosphate. Dual action having both muscarinic and weak cholinesterase action. Example, carbachol. Reactivation of acetylcholinesterase, parlidoxine. 5 types of muscarinic receptor. The M1 receptor are located in the nervous system. The M2 receptor are located in heart and slow the rate and force of contraction. The M3 receptor are located at the endothelial cells of blood vessel and cause vasodilation. Lungs causing bronchoconstriction, the smooth muscles of GIT to increase intestinal motility and dilating sphincters. Glands to stimulate secretion in salivary glands, dister muscle and urothelium of the bladder, causing contraction. They are present in ciliary muscle and the iris. The M4 receptor postganglionic cholinergic nerves possible central nervous system effect. The M5 receptor possible effects on central nervous system. Stimulation of M3 receptor in eye causes contraction of pupil, that is miosis, and alters the relationship of the iris with 3 lanes behind and the anterior chamber angle in front. They contract the longitudinal fibers of the ciliary body and cause opening of the trabecular meshwork and increase the aqueous outflow. They cause contraction of the circular muscle of the ciliary body, thus causing the zonules to relax and allow the lens to assume a more spherical shape, that is known as accommodation. Pilocarpine hydrochloride. It is a parasympathomimetic alkaloid obtained from the leaves of tropical South American shrubs from the genus Pilocarpus. It is a non-selective muscarinic receptor agonist. It was introduced in 1877 for the treatment of glaucoma. When applied topically, it is largely degraded in the cornea. Only 3% enters the aqueous. It is available in 0.12, 25, 5, 1, 2, 3, 4, 5, 6%. Pilocarpine ocular therapeutic system, Occusert. It is available as Occusert P40 or P20 or incorporated into soft contact lens. Is also available in a polymer vehicle as a gel that prolongs the dilation of action. The Occusert releases 3 times the dose for 1 hour and then declines to required value over 6 hours. are to be placed in the clute sac before sleeping so that the induced myopia wanes away by the morning. Uses. It causes complete meiosis on intracameral administration used in contract after lens extraction in penetrating keratoplasty, iridectomy, etc. 0.12% is used diagnostically to confirm Adie's tonic pupil. In this condition, there is a defective parasympathetic innervation to the iris and ciliary body due to post-ganglionic denervation. The affected muscle exhibit hypersensitivity to pilocarpine and hence contract while normal iris does not react to this low concentration. 0.25 to 6% are used in the management of primary open angle glaucoma. It is contraindicated in acute angle closure glaucoma because it causes anterior movement of lens iris diaphragm. As it causes increase in tear secretion and punctual stenosis as side effect. It is used in aqueous tear deficiency, that is known as ATD, that is also known as dry eye. Due to increased salivation and lacrimal secretion, it is used in Singer's syndrome and also for dry eye and xerostomia as an effect of radiation therapy for head and neck cancer. Used to differentiate pharmacological mydriasis from neurological mydriasis. In pharmacological, as the receptor are saturated, the pupil will remain dilated while the third nerve, palsy or Adie's tonic pupil, it will constrict even with every dilute solution. Used to reduce glare in patient with intraocular lens implantation. Pilocarpine is also used to stimulate sweat glands. In a sweat test to measure the concentration of chloride and sodium that is exerted in sweat, it is used to diagnose cystic fibrosis. Adverse effect. Contraction of ciliary body can cause traction on the pars plana as well as causing retinal tear or remotigenous retinal detachment. Cacterogenesis, drug-induced contraction of ciliary body causes increased convexity of the lens and shift the lens forward. Hence causes induced myopia. The causes brow act. Reduced vision during night time due to meiosis, reduced field of vision. Higher concentration use causes myotic iris cyst. Increased lacrimal secretion and punctual stenosis can cause euphorbia, increased bleeding during surgery. Mydriatics. Mydriatics are agents who dilate the pupil and cycloplegics are agents which cause paralysis of ciliary body. Two classes of mydriatics are available. Adrenergic agonist, adrenaline, cocaine, phenylephrine, hydroxyphetamine. They cause pupillary dilation, increase in aqueous outflow, decrease aqueous formation and relaxation of ciliary muscle. Cholinergic antagonist, tropicamide causes mydriasis and cycloplegia. Horner's syndrome. It is caused due to lesion in oculosympathetic pathway characterized by ipsilateral meiosis, ptosis and ahidrosis. The light reflux is normal in this patient but the pupil is slow to redilate in dim light. Phenylephrine hydrochloride causes pupil dilation and conjunctal vasoconstriction using blanching. Action can be reversed by thiazomine 0.1%, 2.5 to 10% concentration, 2.5% use most commonly. Sufficient mydriasis occurs in 50 to 30 minutes, maximum dilation in 45 to 60 minutes and remains for 4 to 6 hours. Since pincer pupillae muscles are stronger than dilator mydriasis caused by phenylephrine is largely overcome by light reflux. Phenylephrine hydrochloride uses. It is used mainly for pupil dilation, diagnostic purpose and pathological condition for cycloplegic refraction before intraocular surgery and in conjunction with myotics as ocular decongestant used to diagnose Horner syndrome. In Horner syndrome, phenylephrine 1% solution administered causes mydriasis more than that in normal eye because of denervation hypersensitivity. Stimulation of M3 receptor in eye causes contraction of pupil, that is miosis, and alters the relationship of the iris with three lanes behind and the anterior chamber angle in front. They contract the longitudinal fibers of the ciliary body and cause opening of the trabecular meshwork and increase the aqueous outflow. They cause contraction of the circular muscle of the ciliary body, thus causing contraindication in narrow angle glaucoma, hypertensives, type 1st, that is diabetic mellitus, aneurysm, cardiac disease, old debilitated patient, patient on reserpine, that is TCAs, mouse inhibitor or cocaine, infants as it increase blood pressure, that is dose per unit weight is high. Mydriatics and cycloplegics, atropine, homatropine, scopolamine and cyclopentatol are cycloplegics that are used in uveitis or acute anterior segment inflammation to reduce for the formation of posterior skinche. They also reduce the permeability of blood aqueous barrier and help to reduce inflammation apart from causing cycloplegia. They can be used as occlusion therapy for amblyopia. Thank you.